brief webinar on BPHC services. First off, BPHC stands for Behavioral and Primary Healthcare Coordination, and BPHC consists of a single service that combines a variety of activities that are intended to assist in the coordination of mental health and primary healthcare services and to also manage those healthcare needs of the BPHC member. So what exactly is included under BPHC care coordination? It includes the coordination of healthcare services, the assistance in utilizing the healthcare system, and the coordination of services across those systems. And now just to break it down a little bit more, coordination of healthcare services can include direct assistance, coordination of care within or across those systems, oversight and management of an entire case, as well as linkage to services. And then secondly, assistance in utilizing the healthcare system. And so logistical support is included in this. And so you might ask, what exactly does this mean? But unfortunately, it does not mean providing transportation. So it can be the coordination of transportation resources, however, or problem solving with the member on or how they are going to get to their appointments. Can include contacting a transportation service on behalf of your client, or even coaching your client to make that call to arrange for those services. As well as, of course, coordination of multiple appointments with multiple providers. Also includes navigation of the healthcare system, advocacy on behalf of your client in order to assist with meeting their health needs. Oops. Advocacy on, here, we'll go back. Yep, advocacy on behalf of your client in order to assist with their health needs, education, and you may ask how this differs from teaching, which would, of course, be considered more of a skills training type of service. Education in this sense can be characterized as providing the member with educational materials about their health condition or or treatments, or reviewing information from a healthcare provider. And then also referral or linkage to medical providers. And once again, it's just not transportation service or providing transportation. And then finally, it is the coordination of services across these systems, which includes physician consults, facilitating linkage and communication between those medical providers, serving as a communication conduit, providing notification of changes in medication regimens and or health status with the treatment team, as well as coaching for more effective communication with providers. Now, this slide just sees that are not BPHC eligible or are excluded. And so that is any MRO service, behavioral health level of need redetermination activity, any AMHH activity, leisure or recreational activities, directly providing medical service or treatment, such as taking vitals, crisis intervention services, any service that's provided to the member at the same time as another service that's in the same nature and scope, any service that's provided while the member is in an institutional or non-community-based setting, a service that's provided in a manner that is not within the scope of limitations of a BPHC service activity, a service that is not documented or covered or approved on the member's FSSA, DMHA approved IICP, any service that activity that is not supported by documentation in the member's clinical record, any service that exceeds the defined limits of the services, including the service quantity, limits, duration, or frequency, and then finally, any activity that is excluded from the service scope of definition. And so then this last slide is just a brief comparison of the BPHC service versus MRO or Medicaid Rehabilitative Option Service. So BPHC is a single service of care coordination. It can be provided face-to-face by telehealth or on behalf of a member. The focus is on the coordination of the individual's mental health and primary healthcare service to best manage their healthcare needs. It can also include linkage, assessment, overall management of the case, referrals, assistance with gaining access to services, education, advocacy, and of course, being a communication conduit amongst providers. Whereas MRO includes multiple reimbursable activities that include but are not limited to case management, ADL skill building, medication training and support, among others. And like BPHC services, MRO can also be provided face-to-face, by telehealth, or on behalf of the member. And the overall focus of MRO services is to build, learn, or regain skills. Thank you very much for your time.